I am Pierantonio Russo. I am the Corporate Chief Medical Officer at Eversana. There are about 7,000 rare diseases which have been identified, and probably 25 million patients in this country have rare diseases. However, it would appear that these patients are diagnosed late. They are not diagnosed as soon as the symptoms and signs of a certain disease are identified. And this is for various reasons. Number one, because there is not enough expertise across the country in rare diseases from a physician perspective. It is obviously limited to the centers of excellence, like the children's hospital, the most prominent children's hospitals, or centers like the Mayo Clinic or the Cleveland Clinic. But also, most importantly, there are only few rare diseases that have an ICD-10, so a code that can be identified in claims. And of those rare diseases that have a code, only 25% are specific. In addition, when we look at the electronic medical records and the documentation of for the physicians, by the physicians of those patients who have interacted with their care system, we found that yes, symptoms and signs are identified, are documented, but the dots are not connected until the patient later, after multiple iterations, end up with the correct diagnosis. Now, of course, we can improve in the future the early identification of these patients with genetic testing. But even that process has been a little complicated because the patient leaves the nursery after a positive genetic test, and no one follows up on that genetic test. And this has happened in several rare diseases as well. So the first step should be to identify the patients who have been diagnosed late or have are still undiagnosed. And today at Eversana we are using machine learning, so a form of AI that, using algorithms, allows to predict the presence of a certain event or a certain condition, a disease, by essentially first studying the characteristics of the patients who have that disease. And then essentially you find the lookalike in electronic medical record or in various databases. Once you identify those patients, it's important to then associate those patients with the physicians who are interacting with those patients, so that the physicians can be alerted of the need for elevating the diagnostic path towards perhaps referral to centers of excellence. The patients in general are more sensitive to, of course, the interaction with their care system, in that they are looking for help. And so you see that there are a number of advocacy groups that help these patients to exchange their experiences, and also exchange counseling with respect to where to go for treatment and diagnosis and treatment. So the opportunity now exists with digital solutions, with technology, to actually connect the various data sources, including patients' data, or at least patients' experience data sources, with various other players in the healthcare system, like the providers, the health systems, IDNs, researchers, right? And already we do have platforms that do that. The Mayo Clinic has started to work on exchanging data among health systems, not necessarily for rare diseases, but obviously eventually they will be able to attract also patients with rare diseases. There are other platforms like Patients Like Me, which are specifically platforms, digital platforms, that share the experience of patients with rare diseases and match them with the correct or pertinent specialist or center that helps them with diagnosis and treatment. Grand Round is another example. Now is part of Teledoc. It was founded by a physician from Stanford when his son was diagnosed with rare diseases, and the doctor used his network to create support for his son, but also extended that network digitally to other patients with similar problems. And so now, with the advent of telemedicine, this platform allows the matching of the patient with the appropriate physician for example, second opinion. So creating this ecosystem that start with all the players in the healthcare system talking to each other and exchanging ideas and exchanging data, definitively will allow better coordination of care and also new discoveries. Finally, generative AI is here to stay in terms of helping better note taking, because again, instead of somebody typing or dictating, now Epics, for example, which is one of the leading electronic medical records system in the country, using OpenAI is able to translate a conversation between patients and physician, patients and nurse, patient, social worker into a comprehensive note. That obviously is important. It is a step up, because we know that social determinant of health and the patient preferences and the caregiver preferences are all important, and sometimes today they are not necessarily captured in a physician note. Creating a metaverse where, even with gamification, the patient, the caregiver can immerse themselves in an alternative reality that reproduces the potential experience of the patient interacting with the healthcare system, specifically with the path that is pertinent to the patient condition, is another way that we can improve the education of the patient experience. And finally, creating twins, synthetic twins of patients with the characteristics of interest, from the comorbidity to the physiological burden of a patient with that disease, allow us simulation of the response of that patient to therapy. And of course, AI and machine learning has helped Moderna to accelerate the production of the COVID-19 vaccine, because using machine learning, they build up thousands of algorithms that allows them to produce thousands of transcriptions, mRNA transcriptions, and then when the transcription of the COVID-19 virus came from China, they already were able to match it to a transcription that was available in the algorithm. So that will certainly improve the ability to create your own drugs. Your body is going to create your own drugs, and this is particularly important in those rare diseases where you are missing an enzyme, a protein that needs to build up by the body.